Hi, everybody in Facebook land. Dr. Erica here.
Hi.
Here's Mary Bookwalter, my awesome assistant, working on week 2 here of getting it done at Maimonides Chiropractic. I am here today to talk a little bit about colic. This is a topic that chiropractors like me deal with a lot. Colic really affects a lot of babies, and in my personal experience, the management of this condition is really poor. It's really poor. And I'm gonna level with you. It makes me angry because we have tons of families that come to us and to others hoping for some help, and a lot of the time they don't get it. I mean, they really don't get it. Colic is a condition which was defined back in the mid-1950s, and the official definition, which hasn't changed since the 1950s, doesn't seem right to anyone, it doesn't seem right to me, is that it's about 3 hours of crying per day, which is a lot of crying at least, and we see babies who do a whole bunch more than that. 3 hours a day for up to 3 months. And what most people get told is, it's okay, it's not serious, and it's going to go away in 12 weeks and nothing bad will happen, okay? And I'm always like, dude, doctor, are you the one who's going to take that baby home tonight and care for it? The parents are, and they really aren't given any help. So we just had a patient come in yesterday with colic, and this poor baby is just screaming off the wall. And the parents are really distressed. Mom is really distressed. She's on maternity leave right now, but is going to be going back to work in a couple of weeks or so. And the baby just screams all the time. And they told her that this is self-limiting, that there's nothing to do about it, and really she's very anxious, so she should take some Xanax. Wait a second. The kid is balled up in knots and intestinal cramping, is screaming for hours a day. They've not slept in 3 weeks, and they're going to give her Xanax for that. Anybody else have a problem with that? That really just ticks me off to no end. And not only that, but the pediatrician told her, there's nothing you can do about colic. It's not true. It just isn't true. Here's Mary. She's a chiropractic child, okay? You ever heard about a baby getting better under chiropractic care when they have colic?
Absolutely.
Like all the time. All the time. And I wish they would just stop saying there isn't anything to do and revert to like, I don't know, but I've heard maybe another discipline has had some success with that. So, I'm just going to calm down for a second. So here's the thing. The mother isn't anxious. She's exhausted, and she's being diagnosed with postpartum depression. Well, no kidding, she's tired. If you actually deprive a human being of sleep, it does all kinds of really magically horrible things to the brain and your expression and your ability to take care of yourself and your child. So we do have to take care of mom and help to coach her about how to care for the baby, how to care for herself, and how to get help from the outside. Because truly it takes a village to raise a child, and right now they're doing it mostly by themselves. And that's just not going to work out until things get better. To go back to colic for a moment, there is really a lot in the literature. But when I did research about this, we'll say almost 10 years ago, one of the things that amazed me is that medicine actually didn't really care that much about this topic. They said it's out there, that it's a thing, and that's non-limiting, that it's totally self-limiting, and there's no further sequela that's involved with it, which, by the way, isn't true. And so they just give medication, they counsel the parent on how to jiggle the baby for a while, and that's about it. The folks who do care about colic and have continued to care about colic going forward, even as to literature a couple years old now, are chiropractors, osteopathic doctors, and nurses. Why do nurses care about it? Well, nurses care about it because, they do a lot of the caregiving, don't they? And they see that it is possible that if you have a child with colic who is screaming all the time, and you have a parent who has no tools on how to deal with it other than jiggling the baby a lot, that you're going to see a detachment of between the mother and the child. Is that a bad thing? Is that self-limiting? It is a bad thing, and it is not self-limiting. Because as soon as you have an interruption in bonding between mother and child, you now have a lifetime of problems. When mom has the perception that there's nothing she can do and cuts her heart off from that child, we now have a whole other world of problems. So the nurses are concerned about, like, what is this doing to infant-mother bonding? Okay. The osteopaths, who have been around as long as chiropractors have, also see that, wow, there is a physiological basis to this. Imagine that, there really is. So the first thing that we try and rule out for kids is, is there any organic disease? Okay, so like bowel problems, infections, encephalitis, things like that. Most of the time, at least in my practice, those are not considerations anymore, but we have to rule out organic disease. Beyond that, you have to look at food sensitivities. The things that really fire up colic, like no other things, are milk, dairy, eggs, soy, and gluten. Okay? Those 5 things. Sometimes mothers try to get rid of everything out of their diet, including chocolate and cucumbers and peppers and broccoli and all this stuff, not knowing that that's probably not the answer. So we then have mothers who have poor nutrition, and that creates all kinds of other problems. So really just taking out the top things that create allergies is enough, particularly if there's a family history, by the way. And what's an interesting thing that I've not ever heard of a pediatrician testing for is something called H. pylori. If that sounds familiar to you, well, it ought to. H. pylori is a bacteria that causes ulcers, which, you know, hurt and stuff when people have it. So it was actually found in a study in Saudi Arabia that when they tested 50 children who had colic and 30 children who didn't have colic, that 82% of the kids who had colic had an H. pylori infection. So sometimes there's an infectious portion of this. Okay, got to rule that stuff out. It can be tested. Okay, next thing is the nervous system. That's where osteopathic manipulation and chiropractic adjusting, that's where we rock. So when the brain receives information from the periphery, from the stomach, from the intestines, from the muscles and so forth, it goes into the spinal cord and up into the brainstem, brainstem is where in the body, everybody? Point to your neck. That's where it is. The brainstem is in the neck. So do you think if it's possible that there's a misalignment of the cranium, the atlas, and the axis, the first 2 bones of the spine, that maybe this would have an impact on the viscera? The answer is yes, because you send a barrage of information from the central nervous system to the viscera and the other way, and we start to hook the body back up with itself. So what do we need to do? We need to look at the upper cervical spine of infants. We need to look at the pelvic diaphragm, so the fascial attachments around the gut. We need to look at the fascial attachments around the diaphragm and the lungs, right? Because maybe part of why babies scream is because they're trying to clear an airway and take in more air, more oxygen. We need to look at the thoracolumbar spine. Look at a Merrick chart. You know, Merrick chart has a picture of the spine, and then all those lines that come out from the side that show you where the nerves go, it goes to the stomach and the intestinal system. We actually have to assess and correct all of these areas. Okay, next thing. We also have to deal with maternal stress. So if you have a family who is living here alone, meaning that parents, grandparents live either across the puddle or in another state, and they're still working and they can't come and help, we have to tell parents, and particularly the moms, that they need to be accepting of help. A lot of the time they think they need to do this all by themselves, and the truth is they really shouldn't. The first thing I always ask patients is, do you belong to any house of worship, a church, a mosque, a temple, anything else where there are people who have an imperative to help other people? So people who are really busy and have big families and have lots of responsibilities, those are the people to ask for help, because those are the ones who are generous with their time. So I say, find a house of worship that you belong to, or if you haven't been in a while, now's the time to go back and start making relationships. These places also have mommy's morning out groups and so forth. Okay, and if they don't want to go to a house of worship for whatever reason, no problem. Find social groups that you like, that have, social action things that you're committed to, or if you're interested in natural health, or, just going to the library and meeting little kids who are being read stories to and things like that. Find other mothers and families who can help you. You must, as a mom, have time to yourself. You must have good nutrition, and you must absolutely 100% let go of anything that isn't vital to the care of your baby, like laundry, dishwashing, nail care, bills, all kinds of other things. I tell everybody, get Instacart or Peapod or one of these services where everybody can bring you your food. Take advantage of delivery of food. Ask friends and ask family with the dietary restrictions in place to give you what you need. Send your laundry out. Go to Costco and buy a big stack of 500, paper plates and plastic flatware, and use that and throw it away. Anything you can do to reduce the expectations on yourself and to relax is important. And also, that last word, relax, is really key. We have to teach moms how to relax. It's very hard when you have a baby who's crying, and really we don't know which comes first, mom's anxiety and colic, or colic and mom's anxiety, or they just happen at the same time. We don't know that. But the truth is you have to interrupt that cycle somewhere. So if mom is stressed and anxious, and I would say this mom we just saw was really very anxious, then we have to teach her how to relax, especially as a first-time mom, right? We need to give them tools. There are apps out there that are for free or $3 to $5 that can do guided visualization, that can allow you to learn how to control your breath. All of these things are important. But what we have to stop doing is telling mothers that colic is this non-serious, self-limiting thing that's not a problem. We just have to stop telling mothers that. And my medical colleagues, look, if you don't know what to do about colic, tell them you don't know what to do. Stop telling them that there isn't what to do, because there is. There's chiropractic, osteopathy, homeopathy, natural remedies like gripe water, fennel-based things, bicarbonate-based things. There are all kinds of things we can recommend to moms. Stop telling them there isn't anything to do. And stop telling them that it's self-limiting. It's not. The research says that kids who've had colic also in life have a very, very high percentage of likelihood of developing things like migraines and all kinds of atopic disorders and psychological disorders as well. So let's stop with the lies and start really looking at what the literature says and start supporting families who have children with colicky babies. It is that important. Rant over. Okay, do you have any questions over here, real quick? Let's see, we see Jennifer, Sherry, Sophia, Rona, Fatima, Jenny, Liz, Natalie, Paige. Anybody have a question? Any question? Okay, one other thought. Okay, so Mary, you've been around lots of babies. Okay, so you grew up as a chiropractic kid and continue to live in this way. When you see a patient like we saw yesterday and their family dealing with this, like what's your hope for them? What would you say to them, having lived the way you have lived? What would you say to them?
Well, it's definitely hard to do it if you don't have, if family is not something that's able to help. Mm-hmm. Definitely something like an outside source, because doing it by yourself is not, it's not easy. I don't even know. That's just not something that's doable. Mm-hmm. And just besides the help with like time to be able to get some rest, other support like getting stuff done and just reassurance that mm-hmm. they are good parents, and yes, this is hard, but they will get past it, and it like goes on, and like mm-hmm. like their pain is not, I mean, not the pain, but like the difficulty is mm-hmm. acknowledged.
Yeah, so acknowledging them for their effort. Yeah, reminding them that they're doing a great job, even if it's really, really difficult. Were you surprised at the care they had received up until the point they came to us?
Yes.
Were you surprised what they were told? What was most surprising to you?
Probably that when they said that it was just keep going, it'll be okay, just mm-hmm. get through it. That's not actually help. That's not actual care. That's just mm-hmm. saying, oh, time will pass, life goes on. That's not enough, because there are things to do.
Yeah, it's not care. It's not care. I think she said it exactly right. It's not care. When you just tell them to just live with it, it'll be fine. That's not care. Fatima has a question here, which is, at what point should parents consider it colic? That's a beautiful question. If you go by the 1954 guidelines of what colic is, then the answer is that it is 3 or more hours of crying per day. In the absence of hunger, soiled diapers, being, temperature changes and things like that. You'll also see, for example, a baby with the hands clamped really, really tightly together. All babies have a palmar reflex where they grab something if you put your finger in their hand. You know how cute that is. But with these kids, it's like clamped tight. Also, you'll see them curled up in a ball with their knees held to their chest. It is a higher level of screaming. It's not just fussiness. It is like full power screaming. So, and also it is often what we call inconsolable, meaning no matter what you do, all the rocking and the shushing and the swaddling and all that stuff, when all this stuff is necessary and you're doing that and you're spending so many hours a day doing it, that's colic. And so that's when I would consider it that. Thank you for that question. Anyone else? Okay, so I hear we have a patient coming in the door, so we got to roll and start serving people. If you have any questions, please leave them below. I'd be happy to answer them. And I'm sorry if that sounded like a big fat rant, but just some of this stuff makes me really upset, and I can't not say it because I really believe mothers deserve a whole heck of a lot better. And we're looking forward to seeing this patient for follow-up today. And, God willing that they're doing much better. If you'd like to hear more on this topic or others related to it or even completely different ones, please send me a little thing in the comments below here, and I will attempt to address it as soon as possible. Natalie had one quick thing. Did you miss, she missed the beginning, do you mention tongue tie at all? I know that was a factor for mine, and it was missed. So, Natalie, excellent point. Tongue tie is something that is a sequela with colic. Not all children who have tongue tie have colic, but I have definitely found, so thank you for saying that, that if there's a tongue tie, lip tie, buccal tie, any of these things here, that without a better mechanism to share with you, I think it keeps colic in place because I think it affects the entire tube of digestion as it goes all the way down. So yes, I have seen that tongue tie revisions do help with that. So thank you. That's a beautiful, beautiful question. Thank you. And we would, later I hope to address tongue tie, by the way, because that is a thing. Now we see that so much in chiropractic offices. It's very much its own huge topic. So thank you. I'll try and do that. Okay, so thanks everybody. I appreciate it, and we will we'll bring more as soon as we can. Have a wonderful day, and be healthy. Take care.